Good morning. This is a special edition of the show, and the show that I had planned for the 10 o'clock hour is now going to be aired at noon today. So most of you have probably heard the good news that the revised health care bill, the replacement and repeal of Obamacare, did pass the House yesterday. And the Congress celebrated in a very interesting way. They celebrated with a beer party. Yeah, they brought in cases of Bud Light, and oh my God, guess what? Republican Congressman Tom DeLay was seen smoking a cigar just off the Senate, the House floor, indoors. It sounds like it was indoors. Can you smoke in the Capitol building in Washington, D.C.? Inside? Seriously, dude, I gotta run for Congress. I didn't know you could smoke. You could use tobacco products indoors at the Capitol. I'd also love to ask Mr. DeLay if he gets charged 60% more for his health insurance that, by the way, us taxpayers provide for him because he uses tobacco. My husband gave up his beloved cigars because he was paying 70% more for life insurance and health insurance. So he gave them up. Guess Tom DeLay didn't. I wonder if his health insurance company knows that he's a tobacco user. My husband smoked like one cigar a month, and he was overcharged for health care and life insurance. Wonder how many cigars Mr. DeLay smokes a week. Kind of reminds me of Arnold Schwarzenegger, who built an atrium in the governor's mansion so he could smoke his cigars while not being rained on or the sun beating down on him or whatever. Funny, isn't it? How the rules just don't apply to some people. But let's look at this healthcare bill. And this is interesting because, and I'm going to remind all of you a little bit of what happened when Obama was president, when I voted for him, and when I approved of Obamacare as I first understood it. And you all wrote to me and ripped me a new one, that I was crazy, that this was going to fail. And you guys were right. And I admitted that you were right. But the funny thing is now is so many of the people who said that Obamacare was a disaster, they didn't want to pay for it, nobody can force them to do shit. Now they're all up in arms because it may be going away. And it's funny who is up in arms and why they're up in arms. And I'm going to tell you something. I watched a lot of news shows. I got up very early this morning and watched the reruns on MSNBC of the shows that were on last night about this topic. And there was this woman on the one show, and she was diagnosed with breast cancer. And she had Obamacare because it was a pre-existing condition, and she was able to get, it saved her life, she said. And she started to cry. No, you're killing Peter to pay Paul. You're going to let me die. Well, okay, I do feel sorry for this woman. I really do. My only question to her, she's 47 years old. My question to her is, when were you diagnosed with breast cancer and why did you not have health insurance before Obamacare? Because again, we have talked about this, that there were just some people in this country who refused to pay their fair share for health insurance, even if it was provided by an employer. Well, it's too much money. We'd rather go to Cabo San Lucas. We'd rather take our kids to Disney. We'd rather have a $400,000 house and 2 Escalades in the 2-car garage or an in-ground pool. Now, I'm not talking about this woman. I don't know her. I know nothing about her except that she's all sobbing that repealing Obamacare could kill her. And somebody should have asked her, why did you not have health insurance before you were diagnosed with breast cancer? And there may be a very good reason why she did not. She might have been unemployed. Or she might have been on welfare. We don't know the answer. But we should know the answer before we feel totally sorry for her. Because as you recall, my husband and I have been paying for health insurance for 30 years. Both when we were together and when we were not together. As single people, from the time we started working, we had health insurance. We never used it, but we paid for it anyway. We weren't so cocky that we said, well, we don't need health insurance because we're 27 or we're 30 or we're 33 or we're 35. Nothing going to get us. We had health insurance. We paid for it. We never used it. And we don't get rewarded for that. That was just money that we gave to the health insurance companies so they could either give it to somebody else or put it in their bank accounts and pay their people bonuses. Never used it. Paid for it for 30 years. So I will ask those questions. If I could interview someone who is crying right now that the only reason they have health insurance is because Obama gave it to them cheap or free, I want to know what you did before Obamacare and why you felt that you didn't need health insurance. So that's a real question. And sure, you can put your thumbs together and start sending me hate mail right now. Go for it. But I will defend that comment because my husband and I, we couldn't necessarily afford $500 a month in healthcare premiums. But we paid them. We did without other things like vacations, like 2 cars, like a fancy house with a 2-car garage and an in-ground pool. We did without those things because we knew that any day we could wake up and we could be one of those people that all of a sudden, bam, we're sick and we need our health insurance. And we've never been rewarded for all that money, over $100,000 easy in 30 years. We've paid. We never got a dime of it back. And how do they reward us? They raise our premiums. They raise our deductibles. They tell me because I smoke and I'm 52 years old and because my husband has a good job, I can afford to pay what a millionaire pays for health insurance. And we're going to get to that. One thing this woman did say that is absolutely correct is that the Republicans and the religious right care more about an unborn fetus than they do about her 47-year-old breast cancer suffering self. And that's true. Republicans saying they want to defund Planned Parenthood and they are right to life and all this bullshit about cells in a woman's body or a 15-year-old being forced to give birth to her rapist's fetus. They care more about that than they do about a 47-year-old with breast cancer. And they do. We know that. Because while they are trying to kick this woman with breast cancer off of her health care, they're also trying to defund Planned Parenthood, which is probably where this woman would go if she loses her health insurance. But they don't even want her to be able to do that because they care more about all these unborn fetuses than they do about living human beings that people actually know and love and care about. So she did make that good point, and it is a good point. And don't start. This is not a show about abortion. We will talk about that on Monday. We got another religious show on Monday, so look forward to that one. This will be a good one, too, because President Trump did something else this past week that just threw non-Christians under the bus, basically. So we'll talk about that on Monday. Speaking of Donald Trump, oh gosh, okay, let me just, let me laugh for a minute. Did you hear what he said yesterday when he was drinking Bud Light and celebrating his big win in the House with this healthcare bill? He's like, oh, yeah, well, I'm the president. How am I doing? Yeah, I'm the president. Can you believe it? If I wasn't the president, I'd probably be out enjoying my life. Wow. Wow. See, I'm sorry, Trump supporters. I am so sorry. But I mean, seriously, guys. Look, I am sure that on January 21st, when Michelle and Barack woke up in the White House, or possibly on January 20th around midnight, Barack probably looked at Michelle and said, "Can you fucking believe it? I'm the president." And Michelle's probably like, "Oh my God, I just fucked the president of the United States." But he didn't say it in public. He didn't say it for the whole world to hear. "Can you believe I'm the president? And wow, it's really hard. Wish I had my old life back. I'd be enjoying my life right now. I can't even go out and get a haircut, which you desperately need, by the way. Yeah, can you believe it? I'm the president." Actually, Mr. Trump, no, I can't believe it. There are millions of Americans out here, very smart Americans, who can't believe it. And I'm not calling your supporters stupid or dumb, because they were sold a bill of goods. But now it is time to get your brains back working and understand that this man sold you a bill of goods, and you ain't going to get what you signed on for. You're not. You're really not. Oh, God, I started, "Okay, I'm the president. Can you believe it?" In public. Ay, ay, ay. So let's get back to this smoking thing and what's going on here, because I'm going to promote this on the smoking pages, the Smokers Against Discrimination pages that I have many of, and many of my friends out there who fight for this all the time. So let's see why everybody hates this new healthcare plan. First of all, Obamacare was an income tax. You were charged based on your income. Not on your health, but your income. This healthcare plan is an age tax. Basically, I can't win. I can't win either way. So, because I am 50, over 50, I will have my premiums increase 13%. Then you add on, of course, the fact that I'm a smoker. So you can add 53%. Basically, 50% more than a non-smoker, and then the 13% because I have had a birthday. Now, I am healthier and happier and feel great at 52 and a half. My health is no different than it was at 49 and a half. But there's that magic number, 50. So 50 to 59, 13%. At 60, the premiums increase more, by like 20%. Simply for having a birthday, they punish you. And see, I keep comparing this to car insurance, because here's the thing. Again, 30 years we've paid for health insurance, never used it, never filed a major claim with a health insurance company. And we don't get credit for that. But if you have car insurance, they give you first accidents forgiveness, right? Or they say for every year you don't have an accident, you don't file a claim, we will either lower your deductible or lower your premiums. Why can't health insurance do that? You wouldn't actually be punishing sick people, but you would be rewarding healthy people. Because for every year you don't file a major healthcare claim, first of all, your premiums either go down or stay the same, and your deductible goes down by a couple $100s. I think that's a great idea. If they can do it with car insurance, why not? And here's the other thing they need to stop doing. Picking up their toys and going home. Just because there's too many sick people on the same policy that my husband and I have. Don't just kick the policy. Don't say, well, we no longer offer this policy. Keep offering it to us. And yes, like I said last week, let the sick people pay more because they use it more. Just like when, like I said, you drive the turnpike, once a year, you pay less than if you drive the turnpike 3 times a week, all year long. That's the way health insurance should be. Pay as you use. But here's something for you smokers out there that's interesting. This came up last night on Nightly News. Heroin addicts. Oh, the poor heroin addicts. They're going to lose their pre-existing health insurance coverage because Addiction is a disease. And there was something going around Facebook yesterday that actually said addiction is a disease, and it is. And heroin addicts get their Narcan at no charge. So why don't cancer patients who also have a disease, why don't they get their chemo for free? I think that's a great question, especially when you remember that heroin addicts, first of all, are usually unemployed, on welfare, on Medicaid, don't pay taxes, and are breaking the law when they inject their product of choice, when they inject their bad habit, when they snort their heroin or smoke their heroin. Heroin addicts are the ones who will rob their grandmother or starve their children to get their next fix. Heroin addicts will slice your throat if you've got 20 bucks so they can get a bag of heroin. They don't pay taxes on the product they use. And yet here are we have our nicotine users, our tobacco users. Not only do we pay more for health insurance than a heroin addict, we're not breaking the law when we light a cigarette. In fact, every time we light a cigarette, a child we've never met gets free health insurance through the CHIP program. Yeah. We actually do good. We're do-gooders when we use our legal product that we are highly taxed on. And if you believe the propaganda about smoking, it's an addiction, which means it's a disease, which then means we should not be overcharged because we have this disease of nicotine addiction or cigarette addiction or cigar addiction like poor Tom DeLay. He really needs some Chantix. And I bet the farm lobbyist will give it to him for free. So let's think about this. If we believe that cigarette smoking is an addiction, we are going to overtax and then give the taxpayers the smoking tax dollars to children whose parents are either too poor or irresponsible or they can't provide insurance for their own kids, which is their responsibility, in my opinion. First Amendment, still there for now. We'll see what happens Monday. And we say that heroin addicts, we're so worried about the poor heroin addicts and the opioid addicts, the people who are basically committing crimes when they use their addiction. And by the way, put your thumbs away. Everybody knows that heroin is death. People who use other illegal drugs know that heroin is death. And I am one of those people. Back when I was very young and stupid, I got into freebasing cocaine. I am not proud of it, but I'm also not ashamed of it. It was the big thing. Everyone was trying it. But even the people who freebased cocaine and snorted cocaine said, don't you ever do that heroin. Ooh, we don't touch the heroin. But today, that's all I heard last night when this thing passed. Oh my God, what the poor heroin addicts? Where are they going to go for treatment? And I'm going to ask this other question because I do know people who have had addictions, alcohol addiction and prescription drug addiction. And do you know how hard it was for them to get a bed in a rehab? Because they actually had a JOB when their addiction was diagnosed. Do you know how much it costs for someone with a JOB who is basically a functioning addict to get a bed in a rehab? It costs like $15,000 a month. People have had to borrow money from family members or take out second mortgages on their homes because their health insurance certainly didn't pay for it. And then, of course, you go into rehab for 30 days because you need it, and you usually lose your job. The boss doesn't like that. There was no help for them, but oh, the poor heroin addicts. What's going to happen to them if this bill passes through the Senate? Who's going to care for those heroin addicts? You know what? This is going to sound horrible. I don't care. I don't care. I have done illegal drugs in my life, and I make no No apologies that I drink like a fish and I smoke like a chimney. But what I do is legal. I don't rob anybody. I don't kill anybody to do what I do. And I have never cost anybody else one dime because of my bad habits. Unlike heroin addicts who do not have jobs, they can't hold a job. Some of them have children and they're abusing their children. They will sell their children as sex slaves if their dealer will give them a couple free hits of heroin. This is what a heroin addict's life is. And this is what I heard last night. Those poor heroin addicts. Well, you know what? They can get their Medicaid, they can get their welfare, or they can go off and sit in a corner and die. And if you are living with someone who is addicted to heroin or you love someone who has died from heroin, I am sorry for you. But for all the times we talk about choice, well, you choose to smoke, you choose to drink, you choose to eat a Big Mac every single day of your life. So, of course, you have to suffer the consequences. Well, you know what? People choose to break the law. People choose to start with that first needle in their arm. I don't know many people who have been held down and forced to try heroin. It's a choice, just like I choose to smoke and I choose to drink. But make no mistake, nobody pays taxes. No heroin addict pays taxes so that little children they never met get free health insurance like a smoker does. The money I spend on cigarettes goes to help people, other people. The money the heroin addict spends on heroin goes to a drug dealer to probably buy guns to protect their turf and kill other drug dealers. We all know how illegal drugs work. And these are the people that's all I heard about last night. That's all I heard about. I heard about the heroin addicts who might lose their insurance or their free shit. And then I heard about people who never had health insurance, never paid one dime for health insurance till they got sick. And Obama opened his arms and said, come on, you can come on in. Paula and Jason will pay for it. Sherry and Jay will pay for it. We want you on health insurance. That's all I heard about last night. I didn't hear one person from my end of the spectrum. Hardworking. Husband making good money. We make decent money. We're not rich. We're definitely not rich, but for some reason, I don't know why, the government thinks we are. And we should really talk about that. It might have to be a different show, but I'd like to ask any of you out there. I mean, I've never seen $500,000 in my life. But some of you out there might be making $500,000. And if you've got children to feed and clothe and put through school, and you have a house to pay for and cars to pay for, do you consider yourself rich? I mean, really, 6 figures today is kind of like $50,000 was in the 50s, 60s, 70s. It's not that much money, really. The house that I invite you into every single day with me, this house behind me, my grandfather, do you know what he paid for this house in around 1939, 1940? $5,000. And he needed a mortgage to pay it. It was a short-term mortgage. He ended up paying it off. But $5,000 for this house. You can't buy a car for $5,000 today. And you can't buy a decent house today for probably less than $250,000, $300,000. So when people used to say back in the day, oh, I can't wait till I hit $100,000, that doesn't go very far anymore in 2017. And yet the government sees 6 figures and they think, well, you're rich. You're the 1%. No, we're not. Nobody is the 1%. The government actually thinks $80,000. If you make $80,000 or over, you're the one, you get to pay more for everything because you can afford it. And remember, that's gross income. They don't know what your mortgage is. They don't care. They don't know how much it costs to feed your children. They don't care. They don't care if you live in a shack and your kids are eating mac and cheese every night, Kraft mac and cheese every night for dinner. They don't care. Right now, their big thing is as long as you pay for health insurance, because we think you can afford it. Sorry, can't afford it. I'm not paying for something I'm not going to use and then sacrificing more than I already do because I smoke and I have to pay all those taxes for that. Not going to do it. I will not pay anything toward anything I'm not going to use, just like I won't get a passport because I don't travel outside my country because our government has put targets on any American's back. I don't feel safe going outside the country. And I feel that if I don't want to travel outside the country, I don't need a passport. But I've got a car. And by the way, I can smoke in my car. I just thought about that one too. Last week I said, oh, I can pack whatever I want. You know, I can have a nice dinner in my car. I can also smoke in my car. That's a lot more fun than sitting in an airport for 4 hours, getting on the plane, flying an hour and a half, and not having a cigarette that whole time. Ooh, awesome. Anyway, that's a different show. But yeah, this is where we're at with the healthcare. And once again, for me, it's a no-win. I can't win for trying. I am 52 and a half years old. I am on no prescription medication and really never have been except for birth control. We're going to talk about that on Monday. But all of the responsible way that I have lived my life, paying for health insurance, getting nothing in return, never getting an atta girl for never going to the doctor, never going to the ER, never going to the hospital. Knock on wood. No reward. And Obamacare punished us because we had JOBs. We had income, decent income. And now Trumpcare is going to punish me because I have lived. I had a birthday, which should be a blessing. I mean, there are 70-year-old men and women out there who run marathons, who play tennis every day, who are very healthy. They're healthy people, and yet they are going to get punished with their health care premiums. It used to be now with Obamacare, we got punished for having a good job, for getting up every day and going to work, for not being lazy, for trying to make a good life for ourselves that we could enjoy, to have those little extras. Now we're going to get punished for simply having a birthday, for being blessed with extra years on this earth. How sad. They say this bill won't pass the Senate. I hope it won't. Not as it is right now. We do need to get rid of Obamacare. There's no doubt about that. Because with Obamacare, the health insurance companies have taken over. Even though the intent of Obamacare was supposed to reel in the insurance companies. It didn't do that. But let's remember something else. The insurance companies are not going to lose money. They will find a way to get their money. They want to be wealthy. They want to pay bonuses. They want to have $500,000 statues in their lobbies. And the farm companies want to get wealthy too. They want to be able to send doctors who prescribe their drugs, who deal their drugs for them. They want to send them and their wives on cruises and out to fancy dinners. They need that money. Until we can truly be like every free country in the world other than ourselves, because basically we're the richest country in the world, but we have third world health care. Because only the very rich and the very poor can afford it. The poor get it free, the rich can afford to pay for it. It's us in the middle who get screwed every which way but Sunday. I'll tell you, my ass is getting a little sore. I'm tired of getting fucked up the ass by insurance companies, farm companies, doctors, hospitals, and the government. I'm really tired of it. But nothing's going to change until, for some reason, I don't know why, but this country fights all the time against national health care, meaning from cradle to grave, you have health care. The day you take your first breath, you get a card, you have basic health care. If you're rich and you want better health care, you can buy it. But at least every single American citizen would have the basic, equal health care. And yeah, taxes would pay for it. But then we have to find a way to make sure that more American citizens actually pay their taxes. And I have ways to do that. Nobody wants to hear those either. So I'm not going to bore you any longer by saying what I wish would happen. But make no mistake about this. Political Paula Luciano, as a human being and a citizen, I believe everybody should have health care. Equal, accessible health care. I'm just getting fucking sick and tired of paying for other people to have better health care than I do. And I really get pissed off considering that I've paid in 30 years, got nothing out of it, and some people can just wake up one morning and, oh, I have the cancer, now I want health care, and Obamacare said, come on up, we'll take you. And by the way, you can pay less than Paula Luciano pays, because she's a smoker. I'm sick of that. Really sick of it. How about you guys? Let me know what you think. This is a really big topic. It affects every single one of us. Even if you think it doesn't, it's going to affect you in some way. Or somebody that you love. Let me know. There will be another show up at noon, and that is the one I was going to do. It's called Defining Friendship. It's a little bit off this topic, but it's a really nice way to end the week. And Monday's show is going to be amazing as well. It came from our really good friend up in Maine, Angie. That show will be Monday. It's going to be awesome. She gave me a topic, and now we're connecting dots, and I can connect so many different things that are happening in politics with the story she shared with me. So look forward to that. And then also Monday, I'm going to do a second show at noon, and that will be some major announcements for a few changes in the show that you will see coming up probably after Memorial Day. So until then, be kind to one another. Stay informed. This is very important. If you don't watch the news, you really should watch now. Something's happening every minute with this healthcare bill. And we'll see what happens. And until then, till next time, love shows and grows. Just so sick and tired. Really sick and tired of always being punished for doing the right thing. Being punished now just because I've been blessed with 5 decades of life. And being treated worse than the Republicans want to treat an unborn fetus in a rape victim. Political Paula, out.